Hi guys, let's see about diabetic retinopathy today. The main risk factor for developing diabetic retinopathy is the duration of diabetes and also the level of HbA1c, which is directly proportional to the risk. Associated conditions like hypertension and dyslipidemia, pregnancy, and also hereditary. Pathogenesis of diabetic retinopathy. Biochemically, we have increased reactive oxygen species and protein C kinase activation, sorbitol accumulation, and advanced glycation in products in the arterioles of the retinal arterioles. And hematological changes like blood viscosity is increasing, leukostasis, and Rowley formation. This causes anatomical features like loss of pericytes, which is the first earliest sign, which leads to the formation of microaneurysms and causing leakage, and also microvascular occlusion in the arterioles. This is causing hypoxia, which leads to production of vascular endothelial growth factor, leading to neovascularization. So coming to classification of diabetic retinopathy, we have non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. For non-proliferative diabetic retinopathy, we have 4 grades. First one is mild non-proliferative diabetic retinopathy. Here there is only one microaneurysm at least. Microaneurysm is seen as red dots in the fundus fluorescent angiography. Moderate non-proliferative diabetic retinopathy, microaneurysm and intraretinal hemorrhage is seen in 2 or 3 quadrants, and mild intraretinal microvascular abnormalities are seen. Intraretinal microvascular abnormalities are specifically seen in diabetic retinopathy. It is nothing but atriovenous shunts are formed. This is seen as fine red lines, and hard exudates and cotton wool spots may be seen. And we have severe non-proliferative diabetic retinopathy. We have 4-to-1 rule, which is 4 quadrants, 4 quadrant microaneurysm and hemorrhage, 2 quadrant venous bleeding, and 1 quadrant intraretinal microvascular abnormalities. If any one of the thing is present, it is severe non-proliferative diabetic retinopathy. If two of things, clinically significant macular edema is defined as thickening of retina at or within 500 microns of the center of fovea, or hard exudates at or within 500 microns of fovea. Otherwise, retinal thickening or exudate, which is of size 1 disc diameter within 1 disc diameter of the center of macula. And we have advanced diabetic eye disease with vitreous hemorrhage, rubeosis iridis, and retinal detachment. The treatment is control of diabetes per se, and specific treatment for maculopathy. For focal maculopathy, we have focal laser photocoagulation or anti-VEGF drug. Intravitreal triamcinolone can be given. For proliferative diabetic retinopathy, we can give pan-retinal photocoagulation.